Yeah, I think all of us with aging parents have some sort of problem, if you want to call it a problem, with pharmaceutical stuff, whether it's pills or medicine or just trying to
Supplements,
understanding
vitamins.
everything and also making sure our parents take it all correctly. Because it's a hard job. I know my sister puts together a little list of everything for my dad,
Hmm.
and somebody does it for your mom as well.
Exactly, because it's really important that they take their medicine that they need to correctly. So we decided to bring in some experts today. So we have Anna and Tony Kantzavelos. They own an independent pharmacy and compounding pharmacy in Indianapolis. So thanks so much for being with us. I think y'all have such a great background because Anna, you're a physician's assistant. Tony, you're a pharmacist. So together you make a wonderful team.
Thank you. Thank you.
Let's just start with where do we sort of start when, I guess, first is helping to understand how important it is for us to know what medications our parents are taking.
Yes.
Critically important. I love, what you two have put together. Start just by creating a list of everything that your parents are on. Go to each individual physician, make sure that you have authority to do so. Your parents have made you either power of attorney or you're able to contact their prescribers, whether they're physicians or nurse practitioners or PAs, right? We have to look at the whole gamut, but make sure you have a list in one area of their most up-to-date medication. Also go to the pharmacies that they're going to. And that's the other kind of tricky spot is sometimes they might go to one pharmacy for one thing and one for another. So be sure, and they don't all communicate. So be sure that you're going to each pharmacy and making sure that everything's up to date and in one place and have that communicated among anyone who might be in your loved one's care.
Yeah.
How important or possible is it just to stick with one pharmacy?
Extremely important. Extremely important. If you stick with one pharmacy, say Walgreens, for example, that system is going to be all linked nationwide, right? Mm-hmm. So stick to one pharmacy. The CVSs, the Walgreens, the mom and pops, their systems aren't communicating with each other. Mm-hmm. So it's very important that you stick to one pharmacy. Also, even the same thing with physicians. You have your family doctor, and then you might need a specialty physician, right, for another condition. Make sure the pharmacist, those, the patients and their other physicians, whether it's their family doctor or their specialty physician, they're all communicating with each other and they all are on the same page in terms of what medications they're giving that specific patient.
Right, because I think that's the confusing part that I've seen is that, you may have one doctor that says, oh, you need thyroid medicine, and another one says you need blood pressure medicine, and then you have another one that says, oh, let's work on your memory or whatever, and all of a sudden now, you have this slew of prescriptions potentially. I want to take some vitamins, or I've heard that this, I take this gummy for,
Right.
And so I guess, it sounds like it would be really helpful to sit down with a pharmacist and say, okay, here's all the stuff, including your over-the-counter stuff, and really make sure there aren't interactions, because that can happen, right? A lot of interactions potentially.
Mm-hmm. Happens on a daily basis. We sit down, we consult with our patients. It's just not drug-to-drug interactions, right? There's drug with vitamin interactions. Mm-hmm. There's drug with food interactions, right? So that's very important in the aging population as well. And just little things like where, a certain patient might be on a dose in their 50s or 60s, but as they age, their metabolism's a little bit different. Mm-hmm. The liver doesn't make the enzymes that it used to once upon a time. So now they're not absorbing things as well. They're not metabolizing things as well. They're not excreting things as well. So that's when we might have to change a certain dose for a certain patient as they age, depending on, their biology, their makeup, their anatomy. So there has to be a constant, communication with the physician, the doctor, and that relationship with the patient on a constant basis, especially in the elderly population when things are slowing down a little bit as we age.
Mm-hmm. I think that's one of the most overwhelming things is that for the adult children, if we haven't been involved in it at all, mom and dad have been going to the doctor on their own. They've been going to the pharmacist on their own. Mm-hmm. And now something's happened to where we're helping take care of everything. So we're like, oh my gosh, you've got 10 different bottles of pills. I don't know.
When do you take it? Is it with food, without food? Is it before?
Have you been taking these? I don't. And they're like, I don't know. Are you taking it? I don't know. So, right. And if that's the case, do you literally take all those pills, the bottles of pills, take them to your pharmacist? Do you call the pharmacist? How should we handle that?
That's a great question, and one that we've seen actually more of now in these last couple of years. of people focusing on their health and really taking time and intention to set aside and say, okay, what am I doing? What have I been prescribed? And so that is in all decades of life that we're seeing this, especially to your point. And I love that you two are doing this. And thank you so much for having this important conversation with us today, because I don't think people recognize as much the importance of sitting down and auditing and understanding what everyone's taking, who's prescribing it, why is it being prescribed. And that's one thing that we're very passionate about. But I'll tell you, the healthcare system is overwhelmed, right? We don't have time with our physicians like we once did to sit down for more than 15 minutes to sit down and say, okay, I have this question. It's just what's your primary concern? And we're going to focus on that today. Big box chain pharmacists don't have time to sit down with you. So I would say the best thing to do is if you have a local independent pharmacy, compounding pharmacy, they have the time and intention and desire and love of really helping each patient independently and not as a transaction. That's what we like to say. You're not a transaction. You're a human being. Let's sit down with you. Let's take the time and just set aside a consult with them and say, yeah. And people have literally brought in boxes and saying, this is everything I'm on and this is what I was diagnosed with. What do you think? And we've been able to help people have better outcomes, sometimes with less medication.
Well, because I think that in society in general, I think often we think of, okay, the doctor gives us the medicine and the pharmacist is really, which is not accurate, but just is the person like doling out the pills. Yet the pharmacist is the one who goes to school and learns all about how all the drugs work and how they interact and all of that. So I think I'm learning the importance of bringing that pharmacist in as a partner in your healthcare. So I think that, again, for many of us, they're not just counting out the pills. You went to school for a lot more than that.
Right. Yeah. The role of a pharmacist has changed drastically, and especially now with having our own pharmacy, our doors open to anyone to be able to come in, but especially for the geriatric population where some of them don't have any loved ones, right? Yeah. Spouse has passed away. They don't have any children. And now they come to our pharmacy with a box of, supplements and medications, and they're overwhelmed. So there's times Anna and I will put them, we'll put the medications in their drug boxes, right? In their drug containers and say, okay, you're going to take this in the morning, right? You're going to take this in the afternoon, take this in the evening before bedtime with your meal, and there's got to be checkpoints, right? They have to be held accountable as well. So come back and see me in a couple of weeks and let me know how you're doing. And if we need to tweak something, let's tweak something. So you need to have that interaction, you need to have that communication, but it all starts with, the pharmacist allowing to be able to do that with these patients, because, like Anna said, a lot of these pharmacies are overwhelmed. I always tell my patients, even, if they're out of state, we can help you if you need help, but try to find a compounding pharmacy close to your city, close to your state where they can help you and you can do this, because a lot of the conferences I go to now, that's what we want to do. We want to help those patients that need help, that are starving for that help. So I stress it more and more, find that local mom and pop pharmacy. They're there to help. They're there to take the time to do what they can to help that patient.
And to your point, Kim, when you mentioned about the prescriber and the patient and the pharmacy, we truly believe in that triad relationship. We don't diagnose, right? But the prescriber does. And they may not be well versed in all the medications the patient is taking, how they interact, but we do. And then the patient's there who are trying to help and serve. And so it's keeping communication with the patient to the prescriber with the pharmacist. Not that we would ever do anything independently or change, dosages or medications or add or subtract anything, but to have a conversation and educate the patient so that they can then go to the prescriber. And if the prescriber has questions, then they can contact us. So that we're all communicating for the benefit of the patient.
We've gotten a lot of questions from our aging parents community.
Oh, really?
One of the biggest has to do with, and several people have asked this, is what do you do about pills, tablets being either too big or don't taste good? Yeah, or they have trouble, digesting or swallowing their pills. What do we do?
Yeah. Again, we do this on a daily basis. There's big horse capsules, right, or big horse pills, and they can't swallow them, right, and they're overwhelmed. My physician gave me this blood pressure medication. There's no way I'm going to swallow this medication, right? This tablet. So this is where a compounding pharmacy is very, very helpful for patients like this, where, we can either crush up the tablets, or if we can actually get the API, the active pharmaceutical ingredient, the actual chemical of that medication, so it doesn't have any fillers or binders or excipients or any inactive drugs, right, or any inactive components to it, or we can compound it to a suspension, put a little bit of bitter suppressor in there. We have some tricks that suppress the bitterness a little bit, and we have like 30 or 40 different flavors where the patient can choose from. And see if that's palatable enough for them. And if not, then, we'll try another flavor.
Yeah.
But we do that on a regular basis for our geriatric population, for folks that are in G tubes, our specialty populations. But that could be done at any compounding pharmacy. And I stress that more and more. You need to take your dose, right? So if you're liking your medication, right, you're going to take that medication, we're going to have better outcomes, right? So yes, please contact a compounding pharmacy, and they can put that into a nice liquid for you. Absolutely.
And so some of it is also asking too, does this come in another form? Maybe there's a tablet that can be a capsule or something like that, because I think that it's just good to know that there's some options, especially if you can't physically swallow it as easily, or just, you have too many to take.
Exactly.
Right.
We mix them up a little bit.
Yeah.
It's a full-time job
That's right.
sometimes. That's true.
That's right. Yeah.
And any tips on managing the medication then, as far as, I guess, I gotten to where we have a pill box for my mom, and we fill it up. I have somebody that, since my mom is out of town, I have somebody who helps me do that.
That's what my sister does for my dad.
Yeah, that fills it up every day. I mean, frankly, I do that with my own vitamins because I think that's super helpful.
Yeah.
But are there other things to make sure that they're being compliant? Because obviously that's so important.
Yeah.
Well, as Tony mentioned earlier, and you can speak to this, is if you don't have a loved one or someone close by who can help go over your medications, make sure you're taking them, it does go back to, the healthcare team is what we like to call it, right? And going in and having a relationship with a local pharmacy. And honestly, sometimes if you're not getting your medications filled there, because compounding pharmacies are specialized pharmacies, but ask if they offer a service that maybe there's a nominal fee, maybe they won't have any fee, to just say, do you mind if, I don't have any loved ones here, can you help me just fill up my pill box for the week or for the next 2 weeks? And I'll tell you more times than not, they're more than happy to do that. So even if you're not using a local independent pharmacy for your medications, they do offer other services. And I would encourage anyone to just reach out and see what they can do to help.
Yeah.
We got a couple of questions about how long prescriptions last. And or if you had some sort of specialty prescription that you were taking and the dosage changed, so they're really no good anymore, what should you do with them? But I guess the first question is, somebody was commenting about that they had prescriptions that maybe their parents had taken or whatever. So there's definitely a shelf life, isn't there? So what's the shelf life, and what do we do with them if they are past that?
Yeah.
Great question.
So your average pharmaceutical, once manufactured, by a big pharmaceutical company, the expiration dates can be anywhere between 3 and 5 years usually. So after that time, you have extra medication, around the house, bring them to your local pharmacy. We have companies, that we work with on a monthly basis where they come in and they pick up our expired drugs, so they are discarded appropriately in the right manner, and this happens a lot. We get calls where, a patient will call and say, well, I got this medication, my mom passed away 6 years ago. Can I still take it? No, it's not prescribed for you. Right? And 6-7 years ago, bring it in. Let me take a look at it and we'll take care of it for you. Right? So drugs are good for a long period of time, A, and B, if they're not for you, don't take them.
Even if it's on the same medication as maybe your parent was, just don't take it. It's best to discard it and get one specifically for you. Yeah. And again, that way your prescribers know what you're on. You're not just medicating.
Right.
Yeah.
If we're worried about what our parent is taking, like if we're afraid that it's too much, or maybe they've gotten smaller, so maybe they shouldn't be taking that. Should we talk to the doctor? Should we talk to the pharmacist? Who should we go to first?
For proper dosage?
Yeah. So, you can always, ask the pharmacist that question, because doses do change as we age, right? So the way we prescribe these medications, where the doctors prescribe these medications, is, either they're fixed doses, which means, the pharmacokinetics of the drug doesn't really play a role on the weight of the patient or the surface area of the patient, right? There's some that are weight-based. So if mom was taking a, 10 milligram dose, when she was in her 50s, we may have to decrease that dose to maybe 7.5 or 5 milligrams as she ages, depending on the kinetics. And when I mean kinetics, the rate of absorption, the rate of distribution in the body, the rate of metabolism in the body, the rate of excretion in the body, right? So all those things play a role. Some docs might not know which meds are weight-based and which are not.
Okay.
That's where we come in part. I mean, I speak to physicians every day about this on a regular basis, but knowing that as I age and maybe mom and dad are having more side effects, right? Maybe that's a red flag, and hey, we may have to decrease this dose a little bit.
Mm-hmm.
Okay.
And I would also think that, just like we talked about with vitamins and whatever other kinds of medications you're on, just over-the-counter pain relievers and things like that also can potentially have interactions as well, right? So it's just important to be aware of how if it's aspirin or whatever might interact with that particular drug. So asking those questions ahead of time for sure.
That's an excellent point. Just because they're over the counter or they're termed over the counter, which means they don't need a prescription, doesn't mean there are no side effects, right?
Or that they can't interact.
Right? Same as vitamins, right? There's some vitamins that interact with your prescription medications, right? So anytime you're going to take a vitamin or a supplement, please ask your pharmacist, this is my list of medications that I'm on. Is it okay if I take this Tylenol at this time? Is it okay if I take, this vitamin C at this time? There's always, like I said earlier, drug-to-drug interactions, drug-to-vitamin interactions, drug-to-food interactions. So we always have to be aware that to contact our healthcare professional just to guide us and see if it's a good idea if we take this additional supplement.
And another point to that is that there are a lot of medications that deplete micronutrients in the body that physicians may or may not be aware of, but can really have some side effects for the patient. So again, it's always good to have just a touch point. We like to say, depending on what your medical conditions are, whether you have new ones or changing ones, at least maybe once a quarter or twice a year to sit down with a pharmacist and say, this is what I'm on. Are there any supplements that I should be taking because it's depleting some micronutrients in my body, right? And that can really help them as well.
Well, and one thing we know to be true for sure, just across the board, is that prescription drugs can get really expensive.
Yes.
Especially some of the more specialty ones, I guess. Yes. Are there sometimes programs that y'all might be aware of as pharmacists that can help, pay for some of these, or special programs that maybe different companies offer? How does that might work? How does that work?
For some of the specialty like injectables and those types of things, I always tell patients, usually your insurance company's not going to cover it, right? They're going to want you to take a cheaper alternative, So that's where the doctor has to help with a prior authorization and help get that covered. Or I will tell the patient, call Eli Lilly, for example. They might have programs for folks like you for a couple of months and try it out and see if you can get guidance that way, But yes, unfortunately, that's how the way the healthcare system is. And they're not going to cover all the drugs. So let's reach out to the physician and say, hey, doc, let's see if we can get a prior authorization for this medication for this patient because they tried A, B, C, and D and it didn't work. And if that doesn't work, then I always tell the patient, reach out to the Pfizers, reach out to the Lillys. They always have some type of perk, always some type of program that can guide the patient to get the medication covered.
And again, the point is, speaking with your pharmacist and saying, okay, do you really need all of these medications? Is there another alternative that you can take? And there many times there is. So that's just another consideration as well.
I was just going to say vaccines, of course, have been the hot topic for the last couple of years because of COVID. But take COVID out of the picture, and how much should we worry about flu vaccines every year for our aging parents? And my dad just had to get a shingles vaccine. I know
there's pneumonia.
There's all types of things. How much do we need to worry about that? Or do we wait until the doctor says something?
Yeah, that's a great question, and you can speak to this as well. I think the main thing is that we are not all one size fits all. That's really what we believe in. Every patient is unique and has different needs, has different risk factors. So I think one thing is to decide on what are your risk factors for all of these conditions. We're not necessarily all pro-vaccine and we're not anti-vaccine. I think we really need to consider, and I know that's not an easy answer, but really consider each patient individually. But to your point, and I love, what you both have created for your group there is, it's everything in one place. And so you can go and say, okay, when was the last time they had a tetanus shot, right? Which is not every year, right? So when was the last time they had tetanus and flu and shingles and your pneumovax vaccine? So those are things to keep in mind. But again, it goes back to every individual patient and what their risk factors are. I would say for those vaccines, they're pretty benign. People take them, most of the time every year. But I won't say that it's for every patient. Some people are surprised sometimes that we don't take all vaccines that are recommended because we just decide for ourselves what is best.
So definitely a conversation to have with your doctor.
Absolutely.
And your pharmacist.
Absolutely. But definitely have a list of when they've taken them, when their last dose was, their last vaccine was, and then have a continuous conversation.
Sure, absolutely. Anything that I know that we could probably talk for all afternoon. Anything pressing that we missed?
I guess just for the aging population, just watch some medications that your loved ones are on. I see that there's a family of drugs called anticholinergics, for example, the Benadryls of the world, the chlorpheniramines, the Bentals. Those can have some side effects to our geriatric population, so, and I see that sometimes patients coming in, and sometimes we'll interact with the doctor and say, hey, can we give a different antihistamine that doesn't have these, these adverse effects, right? Because this family of drugs, these anticholinergics, what are their side effects, right? Dry eye, dry mouth, urinary retention, constipation, and mental fogness, right? Forgetfulness, right? And some doctors, they're a little bit busy, or this patient's been on this medication for the past 20 years. Just keep them on. It's working. Why not? But now mom and dad are having some issues on these categories I just stated, right? So just kind of every so often address the medications that your loved ones are on, because just because they're on it a long time ago doesn't mean they still have to be on it. There might be better alternatives now, right? So that's just one little, just one little perk that I always like to tell my patients. Hey, let's sit down, let's see what you're on now, and see if we can tweak things if we can.
And I would just say in closing, this is not meant to be overwhelming. I mean, there's a specialty practice in medicine for medications. So I know this can sound overwhelming, that there are a lot of boxes to check and all these different medications, but that's not to be on the loved one or the patient's shoulders. So, go to your local pharmacy. That's what we love doing, is taking a 360 view, right? Once a quarter, twice a year, whatever it is, and just say, okay, what is a new medication you're on? What's a new diagnosis? What is something that you no longer need to be on? And just sit down with them. It could be just 30 minutes and take a look and say, okay, great. This is your plan now for the next 90 days or the next 6 months. Or maybe we need to contact your prescribing physician and have a conversation. So not at all to be a burden on the family or the patient. This is just really just to be educated, to allow some conversation and maybe points that they've never really considered, and say, there are other avenues other than your prescribers to get help, and for people to sit down with you and to help you navigate this, because it's a community, right? We're all linking arms and helping in every way we can.
Gotcha.
Exactly.
All right.
We're all in this together. Anna, Tony, thank you so much for answering all these questions and helping us not feel so overwhelmed.
Well, we thank you for having us.
Thank
We
you very
appreciate it,
much.
and for the work that you're doing.
Thank you very much.
Yeah, so I guess first just got to get that list and try to figure out what they're taking and help them see the importance of the compliance, because obviously your medicines can't work if you're not taking them. And so I know that's a challenge for a lot of people too.
And don't be afraid to ask the questions. Get the help, get the advice, because again, it's better safe than sorry.
Right. And there are other people who are better educated and are trained to understand medications where we might not.
Exactly. Remember, if you have any topic you'd like us to talk to an expert about, let us know at Parenting Aging Parents.